let's talk about some false speaking. Dr. Tim Wheeler with Doctors for Responsible Gun Ownership is joining us on the program. Dr. Wheeler, good evening, sir.
Good evening, Cam. I love your bumper music.
Well, thank you. You know, today would have been Jimi Hendrix's 70th birthday.
Yes, yes.
And he
May
probably
he rest in peace.
absolutely. And you know, we saw you know, the seniors vote go for Mitt Romney. Perhaps Jimi Hendrix would have been one of those, you know, baby boomer original hippies who would have become more conservative, would have you know, clung bitterly to his independence and his individual freedom, those ideals that were so sacrosanct in the 1960s that now seem to have disappeared from the left. Now we've got this piece in the Denver Post. It's the latest of many articles talking about the need to do something about firearms from a public health perspective. Garen Wintemute, who practices emergency medicine at the University of California at Davis School of Medicine and is the director of the Violence Prevention Research Program. You know this guy very well, right? He's been writing about guns and gun issues for years.
Yes, he certainly has.
He's
been skulking around gun shows and doing opposition research to try to write these pseudoscientific articles that paint gun owners in the worst possible light. I've been writing about him for a long time.
Yeah, he says guns are where tobacco was in the 1950s. There's a little bit of science and a great deal of reluctance to do anything with the result. You know, look, first of all, it seems to me, Dr. Wheeler, that when there's only a little bit of science, there should be a great deal of reluctance to do anything with the result. There's only a little bit of science. Secondly, you know, the idea of talking about gun ownership as a science and ways to limit gun ownership in order to maximize public health, I got to tell you, that creeps me out.
Oh, yeah. You know, these writers and these fresh-faced young reporters, I really don't know this lady Colleen O'Connor who wrote the Denver Post piece.
Mm-hmm.
I did speak to a reporter at the American Medical News who wrote almost this same article word for word. That's the AMA, American Medical Association's, one of their publications. We're getting a rash of these op-eds now, and each one of them could have been put out in the early 1990s when this whole thing started flaring up. They complain that there's a lack of research about so-called gun violence. Well, there's a reason for that, and that is these medical researchers were shut down because their federal funding from the Centers for Disease Control was violating the law. They were using federal funds to advance this gun control, basically a political agenda. The fact is that there's plenty of research out there that is privately funded by universities who are privately funded. The problem is, according to the medical gun grabbers, it comes to a completely different conclusion, and that is that firearms are safe, in good hands, and actually a social benefit. They provide the means of self-defense. So that's why we're seeing these articles now.
Yeah, well, absolutely. And, you know, it's interesting. I'm looking here at this Denver Post story. They talk about the U.S. Surgeon General's 2001 report, Youth Violence. And according to this report, the Denver Post says the top risk factors for youth violence include being involved in serious but not necessarily violent criminal behavior, abusing substances, being male, having physical aggression, coming from a low family socioeconomic status or poverty, and having antisocial parents.
Like this is news?
You know, exactly. You know, this is it's mind-boggling to me, Dr. Wheeler. We were talking about this earlier. We know the FBI has said that in a lot of major urban areas, about 80% of violent crimes committed by about 20% of the gang members. We know who these gang members typically are. The FBI says there are about 1.2 million gang members in the country. So we're talking about maybe 240,000 individuals who are known to the community, who are known to law enforcement, who are responsible for a predominant or a large number of crimes. If we focused our efforts on those individuals, as opposed to focusing our efforts on the 90 million legal gun owners in this country, what could we really achieve?
Well, since that's where the problem is, we could achieve a lot, but it is forbidden to even mention that in discussions with the public health folks.
Well, why not? Wouldn't you say that these cases? Look, if you want to use the public health argument, then aren't these individuals patient zeros, so to speak? I mean, aren't these the disease vectors? Or give me some snappy medical language, Dr. Wheeler. I mean, this is where the problem starts.
Yeah, the index cases is what they would call it.
There you go.
Exactly. But that goes against the whole philosophy of the public health anti-gunners. They, instead of looking at people and holding people responsible for their actions, the actors, they look at the gun, and it's much easier to blame the gun, which is this inanimate object, and treat guns as germs that need to be eradicated. That's much more consistent with their general philosophy, is that they don't want people in general to be empowered by the right of owning firearms.
You know, and it's fascinating. There was a very lengthy article in the Denver Post. Gun violence can be solved with science, public health experts say. And there's even a paragraph in here. The public health model was used to successfully decrease the number of motor vehicle fatalities in recent decades. Instead of trying to change the behavior of drivers, safety measures were increased in the world around them, including seatbelt legislation, airbags, raising the minimum drinking age, and increasing the use of motorcycle helmets. This story in the Denver Post, Dr. Wheeler, talks a lot about using public health measures to solve gun violence, never actually get specific about a single measure that they would introduce under the guise of public health.
No, they don't, and they know that to do so would get them in hot water very, very quickly.
Because it would sound a lot like gun control, right?
Oh yes, it sure would.
That's so. Given that this started in the 90s, it's now coming back once again. And by the way, how much of this is coming back because crime rates are dropping while gun ownership is going up, and so the whole more guns equals more crime argument is not effective? So now let's talk about guns as public health.
Oh, yeah, it all fits together. And Cam, just a quick note about what you said about consumer items and seatbelt legislation, mandating airbags, reducing motor vehicle accidents. They want to apply the same kind of consumer product regulations to guns. That was tried back in the 1970s. I actually wrote about this. And Congress just basically cut them a new one. I'm sorry. Can I say that on the air?
I think so, sure. That's a medical term.
They quickly came down on the public health anti-gunners for even thinking about trying to do this in Congress, and that went nowhere. But they keep bringing this up over and over again. So our job as supporters of the right to keep and bear arms is going to be to publicize these arguments, to expose them, and to show that none of these ideas are new. They've been brought up before, they've been discredited before, and we will discredit them again. Look to our website at drgo.us for a lot more traffic on this very subject and for the arguments that responsible gun owners can use to discredit and defuse these public health arguments that are coming up again.
All right. Listen, Dr. Wheeler, thank you so much for coming on the program, sir. Great talking to you tonight.
Thank you, Cam.